obvious, but people don't know the simplest thing, like short-term memory is only 30 seconds long. People will repeat themselves with dementia or any cognitive decline and then not realize it.
Hi Anjali, thank you so much for joining us today. We are very excited to talk about Jerry's Gadgets. And as I understand, the idea behind this came from a deeply personal story for you. So I think it can be a great starting point for our conversation if you talk a little bit about the vision or inspiration behind Jerry's Gadgets.
Yeah, well, I mean, I didn't get into healthcare on purpose. It was all by accident. I was a career television producer in music variety and music specials award shows in California as an executive in charge of production. It means I'm actually a problem solver. My mom got dementia back in 2010. I first saw signs of it. And she was misdiagnosed. She was misdiagnosed with Alzheimer's when she actually had Lewy body dementia, which made it even more difficult to reach her. And her behaviors were bad because she was given one antipsychotic medication after another, and that resulted in terrible side effects and 7 different hospitalizations. Well, when she was finally, 4 years later, properly diagnosed with Lewy body dementia, we had a better idea what we were dealing with. At least she wasn't medicated. But those behavioral problems, she was kicking and biting from fear, were still coming out. So we had this very big concern that she wasn't going to be taken care of. I mean, she was home for half the time and then had to go into a facility because she needed 36 hours of care in 24 hours. But anyway, that being said, when she finally was properly diagnosed, I saw her touching shiny magazine paper with her fingers and rolling it. She had a clenched left hand. And because of that, I started to see, oh my gosh, there's a sensory need trying to get out. And that's when I began to bring toys from the children's department. And what I found with those is that they were either too childish, too complicated, toxic when put in the mouth, or just not not washable. So that's where Jerry Gadgets started. Once I found silicone to be the perfect material.
Good. Yeah. Thank you for sharing this deeply personal story. And I think this makes Jerry's Gadgets a very authentic company because this originated from a personal challenge you are trying to overcome. So tell us about when you go out in a typical healthcare system, what are the misconceptions or what are the common things you have to fight through in order to make sense of what you are trying to do, especially with
Well,
these
I mean, I
gadgets?
think there's some really obvious things that people just don't know, and you think they're obvious, but people don't know the simplest thing, like short-term memory is only 30 seconds long. People will repeat themselves with dementia or any cognitive decline and then not realize it. So a caregiver might get frustrated, and there's no reason to do that. So I use an acronym: don't, dare, don't, argue, react, or explain. So dare, don't argue, react, or explain is really one of the things I educate people with, because we don't need to be right. We just need to meet somebody where they are, which is really the point. Acceptance of the past, and then, try and connect with them, engaging in the smallest ways, because small is big when it comes to cognitive decline, especially as they proceed in their disease.
Makes sense. So I think I loved this idea of from Jerry's Gadgets website that creating a moment of connection. I think that's all that sums it up. So for our from our listeners, if someone's loved one is going through cognitive decline, Alzheimer, or a situation like that, what would you recommend them to create the moments of connection with those loved ones?
Well, I mean, I created Jerry Gadgets, which come in 3 different kits. This is fidgets. And so you basically have to know the personality of the person too. And those have all these fidget items. So I'll just start with, like, I basically cut down a pot holder back in the day when I first created this. It had serrated edges, so I don't recommend that. That's what your viewer do. But I brought it to my mom and we threw it back and forth like a frisbee, and that changed everything. Once she loved the crunch sound, the texture. So silicone is the perfect material. It's the closest material to human skin. So that's where all this stuff started, was with this idea. So the fidget bucket has different things. We've seen poppers, but again, like my mom had a clenched hand. So these exercising the hands and arms happens with these items without the person really realizing it. And you can engage. This is a click chain and it has sound on purpose and it's very sturdy, won't go over the head. And that can remind somebody of cracking ice or walking on fall leaves. And then there's the tugger, which also could be one person or two, but it also lays, it's kind of fun to squeeze and pull on, and that's exercise as well as we've seen frigid items, but there's no goo inside this, and I would say the egg is the Goldilocks. It's not too big, not too small, not too hard, not too soft. So it's exercise in the hands, but we can engage in it, rolling it back and forth. It doesn't have to be a single thing. So that multi-generational thing is really important. And then this one is the shapes bucket, and they're Tetris inspired.
Right.
And this is a puzzle. So it's great multi-generationally. Has a stars on one side and a smooth surface on the other. And they fit together in any way you want them to. So if somebody is further along, they're going to lay them down. They might even just put them in their mouth. There's no wrong answer with any of these. And so you can create a structure, a house. You can do dominoes or something if you want. But there are endless possibilities, which creates this sense of accomplishment and success when you use them. And then I have the flower bucket because everybody loves flowers. And my uncle was a florist, so everything was sort of. And then these, were really sunny and fun, and they fit in. But they're super sturdy, also dishwasher safe. That you can do them a normal way, like I just have, but the vase is reinforced, so they can be done silly, and that's beautiful too. This is strength. There's strength in this, so that's fun. So these are tools. They're not the only tools on the planet, but these are certainly safe and dishwasher safe. People do things like folding towels. That's safe because it keeps somebody busy. But what happens with something like this is, the reason for the bucket really is the dopamine that's created by the curiosity. Not only that it's tidy and it's neat to keep everything inside, but that. And then when you do engage with somebody, you're creating those love and hug chemicals,
Right.
of oxytocin and serotonin. And what people need to know in your audience is that 15 minutes of engagement can last a couple days. So
Right.
those small visits are huge because those positive chemicals stay with somebody longer than the visit.
Absolutely. Makes sense. So, I think you know this very well that everything is moving to digital products or applications, and you are focusing on physical touch. Your products are more on the physical touch. So it is easy to measure the impact of a product if it's a digital product. You have visibility, you have statistics that you can really depend on. So for Jerry's gadgets, how do you measure the effectiveness of these gadgets for our listeners or one who are using it? What are those key elements they can really observe and be mindful to see that this is working out for them?
Well, they really do start with calming the person. Be- the very touch of the silicone is very soothing and very calming. And then it's that connection that really, if somebody is sitting there like this and you introduce Jerry gadgets, they really rise with the sun, like the tulips do. And they really do become involved, especially if you were to throw one of the sensory mats to them, and they'll catch even like this, and nothing will harm them. And then it's an engagement session, and it's really quite fun. And those are measurements clearly. So the calming and the connecting and that sort of engagement, The fact that there's so much safety with them too is really great because, if they're busy, they're not going to get up to fall. They can shower, bathe with them. They work great, those
Absolutely.
kinds of things. They're great even taking them if you want to take your loved one out to a restaurant or a doctor appointment.
Yeah.
Travel becomes really high stress for people. And they'll immediately see that having something like this is very soothing and calming.
Yes. Yeah. Yeah, it's definitely going to be very useful, especially in an environment where the weight is involved, or you are depending or waiting for something. So it totally makes sense. Want to understand your thought process or design principle behind these gadgets, because you have these gadgets for a specific uh, uh, with the individuals with cognitive decline, and it's not a typical product thought process. There must be something different behind the design principle you used for these gadgets. So if you talk a little bit about your design principle for these, that would be great.
Well, all of them are interactive. So it really was about having something to do rather than just looking at something pretty that's sitting on a counter. Or,
Hmm.
so everything was created with uh, items in mind to interact with, to engage with. So each thing there's something to do. So, if and that was really part of the creative process. I was a big fan of Tetris, so I loved the game part of it, and that was an electronic version that was made here. Here's an analog version. I loved, yeah. So it's really about, and these work really well in conjunction with music, or somebody's doing a test and they have a headset on and they can't stand the headset. Well, if they're holding a Jerry Gadget bucket, those kinds of things are really calming too. So all of it was kept in mind to just simplify the process of stressful situations. And
Right.
stressful situations are bathing sometimes, transportation, even on visiting somebody, a loved one doesn't know what to say to their parent or their uncle or somebody that has cognitive decline, and here you don't need words, you can just engage.
Yeah, yeah, makes sense. So, just like any healthcare application or product, are there also any compliance or regulations that you have to follow in order to get them to production and real use?
Yeah, well, everything is medical grade silicone. The amount of tests you go through for that are extremely high, FDA even, so that they're mouth safe. So it was a whole list, and I'm from California, so California is even really strict on product levels of stuff. So it was there's quite a bit of testing that goes into that. So you name it, lead, uh, any sort of metals, all of that is makes it safe now because they've been tested.
So, I want to ask you one question, and especially with respect to the widespread adoption of these gadgets. Do you think that gadgets like this are going to be part of big digital, big healthcare ecosystem where you see that these are being recommended by physicians, by professionals more and more? And do you see gadgets like that being part of, for example, EMRs, or being part of tracking in inside all those modern tools?
Yeah, I actually do. And ultimately, Jerry Gadgets will have, because there's so much happening in terms of advanced technologies and things like that, that ultimately we'll be able to marry the two together and relieve caregiving and stuff like that, because microchips are so tiny, and it'll still have the ability to be washable and mouthable and all these things. So I think, yes, I really do. That's part of the plan.
Right. So do you also have a network of healthcare professionals who are recommending these gadgets, or how is right now it's being adopted by users?
Yes, well, there are OTs and PTs really like them a lot because they're great for exercising the hands and arms, and definitely doing those sort of rehab kind of things, as somebody with arthritis and a stroke, all of these things OTs and PTs love. So I'm involved with a number of those. Also, home care providers are taking them with them to when they visit somebody so that they can engage and create that positive experience. And then family members, but of course they're in memory care, assisted living, and adult daycare is really effective with adult day because it can be a group activity as well as a single activity with somebody or even by themselves.
So, are you also looking to expand to the rest of the world as well as part of your growth plans, or where is your big user base right now for these gadgets?
Well, I mean, US is the first market, but I am in Canada. I am in the UK, Australia, and New Zealand. Yeah, Japan is marketing them, and they just finished a study, and so we'll see if I can be in Japan as well, China even, as long as they're priced right for them. As long and the more we manufacture and make, the better it gets. But clearly, it can reach anybody and everybody, so we'll continue to grow that way.
Perfect. So, final question from my end, Angela. I want to know about your big picture vision for next 2 years, 3 years. Are you looking to expand and add more gadgets, or you are putting research into what else you can cover with this? So how exactly you are thinking about the future for Jerry gadgets and where you want to be with this in next couple of years?
Yeah, thank you for that question. Well, we're going to continue to span globally. I do have ideation of probably I have 28 kits in the pipeline. In the next couple of years, there won't be all 28, but we'll continue to roll them out as we can and do. So there's certainly that, and we'll just I want to be able to what I have been doing and started is the New York State Office of Aging, for example. So they just started a pilot. I want to continue to expand those in other states and continue to reach people that in rural transformation healthcare settings and in the skilled nursing facilities, the CMP funds that are available so that places that don't have the budget normally can receive that in a form of a grant so that they can get the Jerry gadgets along with the training, the train the trainer model. So this train the trainer model is really important because not always is there a paid healthcare activity director or somebody up on this level, but they're able to train somebody who just comes in and simply shows them, and then informal caregivers can do it as well. So that's what that idea is.
Sounds great. And thank you so much, Angela, for sharing this, your journey, your story. And I think this is powerful and this is unique as well because everyone is trying to solve healthcare related challenges using digital products. But you have focused on the physical touch, which is, I think, a very unique idea during the current times we are. So thank you so much.